Hi, everybody. My name is Sarah Benatar. I am a Principal Research Associate at the Urban Institute, and I'm really excited to be here today presenting to you on the Home Visiting Career Trajectories study. I'm going to hand the mic over to our project officer, Tia Brown from OPRE.
Hello, good afternoon, good morning, everyone. My name is Tia Brown, and I serve as the Adolescent Development Research Team Lead in the Office of Planning, Research, and Evaluation in the Administration for Children and Families. I've served as the Federal Project Officer on the Home Visiting Career Trajectories study since its inception. The Administration for Children and Families and Health Resources and Services Administration are pleased to welcome you to today's Home Visiting Career Trajectories public webinar. Within the last 10 years, there has been a rapid growth in evidence-based home visiting programs. Recruitment and retention of qualified home visiting staff has emerged as a key topic of discussion during this expansion. When the Home Visiting Career Trajectories study began in 2016, less was known about factors that contributed to those entering the workforce, those who were retained, and those who left the workforce. This study is the first to comprehensively describe the home visiting workforce supported by the Maternal, Infant, and Early Childhood Home Visiting Program. The MCV program is administered by the Health Resources and Services Administration in partnership with ACF and supports voluntary, evidence-based home visiting for at-risk pregnant women and parents with children up to kindergarten entry. The MCV program builds upon decades of scientific research that shows home visits by a nurse, social worker, early childhood educator, or other trained professional during pregnancy and early childhood improve the lives of children and families. The Home Visiting Career Trajectories study sought to learn more about how frontline home visiting staff enter the field, why they stay, and how they would like to see their careers progress. We hope that by better understanding home visitor characteristics and career aspirations, we can better support our frontline workers in the critical work they do, which is so integral to improving the outcomes of the children and families they serve. Both HRSA and ACF hope to use the study's findings to strengthen our technical assistance and other programmatic resources to support MCV awardees, local programs, and model developers in their various workforce development initiatives. We also hope to use this information to facilitate further discussion and collaborations between our various stakeholders to support and improve the professional development system and recruitment and retention practices for home visitors and supervisors. We would like to thank all the state and local program staff who participated in the surveys, interviews, and focus groups as part of this study, and the urban team for their expertise and partnership throughout the process. We're really looking forward to your questions and thoughts, both today and moving forward, about how these findings resonate with you and additional thoughts you may have on practical strategies to improve supports for our frontline workers. So thank you again, and with that, I'll turn it back to Sarah.
Thank you, Tia. First, I'm going to just go over, a few housekeeping items for all who are on the Zoom this morning or this afternoon. First of all, the webinar is being recorded and will be posted online after the webinar. You can see or listen to the webinar again or share it with colleagues and find it on our landing page, which I believe folks should have received when they registered for today's webinar. All participants will be muted throughout, so if you have questions or comments, please do type those into the question and answer box at any time, and we will do our best to address them at the end of after the presentation, before the webinar ends. Please be sure to include your name and organization when you do type a question or comment. So with that, we'll get started. So the Home Visiting Career Trajectory study had two goals. The first of which was to examine the characteristics, qualifications, and career trajectories of home visitors and their supervisors in MCV-funded home visiting programs. Additionally, we sought to review the professional development system that exists for home visiting staff and understand existing strengths and gaps to help strategize for building a pipeline of qualified home visitors and supervisors on an ongoing basis. The work was guided by 5 primary research questions. We sought to answer what the characteristics of home visitors and supervisors is, and this included both the demographics and qualifications of home visitors as well as their employment history. We also were interested in characterizing the, home visiting jobs themselves, understanding schedules that home visitors typically keep, what their compensation and benefits packages look like, and the work environments in which home visitors operate. We wanted to look at career pathways of home visitors and supervisors, both from the very beginning, understanding motivations that they have for entering the field, as well as ongoing career satisfaction and reasons for turnover, as well as the role of burnout in home visitor careers. We were interested in understanding what strategies programs use for recruiting and retaining staff and what challenges they face in both these domains, and then the opportunities that exist for professional development and ongoing training for home visitors. We implemented a mixed methods design for this study with both a qualitative and quantitative component. The quantitative component was made up of a 2-part survey. The first stage of the survey was to reach out to program managers at local implementing agencies that were McV funded throughout the country, and asked them to complete a web survey that was approximately 20 minutes long. In addition to answering the survey questions, we also asked program managers to provide us with contact information for home visitors and home visiting supervisors, who we then shared a separate online survey with, and asked, which was also approximately 20 minutes long. We received response rates of over 50% for both the program manager survey and the home visitor and supervisor survey, and had fairly good representation across the nation, with most models being represented, including 9 evidence-based and 4 promising approaches, as well as regional representation. The qualitative component of this work included case studies in 8 states. Those states were Arizona, Connecticut, Georgia, Maryland, Michigan, Montana, New Mexico, and Tennessee. 7 HRSA regions were represented, as well as 7 models, including Child First, Early Head Start, Family Spirit, Healthy Families America, Nurse-Family Partnerships, Parents as Teachers, and Safe Care. We chose these 7 states in part for both regional and model diversity, as well as the opportunity we had to visit tribal McV grantees. We conducted 3-day site visits to each state, and within each state we reached out to multiple LIAs with the goal of speaking with 3 to 4 local implementing agencies while we were on site. During those site visits, we conducted interviews with program managers and home visiting supervisors, and then focus groups with home visitors. A second qualitative inquiry included an exploration of the professional development system. Here we did a fairly comprehensive literature review and scan of online resources, as well as expert interviews with at least 15 key informants. Importantly, the questions that informed our professional development inquiry were also integrated into our case studies, so we had the opportunity to investigate the professional development system while on site as well. So a quick preview of the implications that came out of this work, and then I will go into more specifics on the key findings. But ultimately, we observed that investing upfront in strategic recruitment efforts is really critical for finding qualified staff that are a good fit for the position. And the good fit piece is really important and something that we learned throughout as being critical to both retention of quality well-qualified home visitors, as well as recruitment and retention of well-qualified home visitors. We also observed that it's important to create a system that supports professional development, goal setting, and continuous learning to keep home visitors engaged and satisfied. There is great importance to making home visitors feel valued, and some ways in which we learned that program managers do this is through team building and regular reflective supervision. And then there are few opportunities currently for leadership and advancement in home visiting because it is a very narrow pipeline, but we heard that it's important to think about ways to create those opportunities. Okay, so the first key finding that I'm going to talk about is that home visitors and supervisors are diverse in age, as well as educational background and career pathways, but they do lack gender diversity and are not as racially or ethnically diverse as the families that they serve. So we found, based on our survey results, that nearly all home visitors and supervisors are women. This may not be a surprise to many of you, but this is verified in our data. Home visitors also range widely in age, from their early 20s to their late 60s, though the bulk of home visitors are between 25 and 44, and supervisors, as might be expected, have a slightly narrower age range. Approximately 2/3 of home visitors are non-Hispanic white, and more than 40% report having similar traits to most of their clients, though many, approximately 20%, slightly less than 20%, report that they have very little in common with their clients. There are about 17% of home visitors who are fluent in Spanish, and 5% who are fluent in a language other than English or Spanish, for that matter. Okay, so really interestingly, we observed that many home visitors have relevant experience prior to becoming a home visitor. Many were either prior to their current job, so many were a home visitor for a different employer, and others, more than 50%, were a frontline worker in another health and human services field. We also observed that many had education experience, early childhood education experience in particular. We found that staff qualifications were quite strong and often exceed model recommendations. Specifically, we observed that over 70% have a bachelor's degree or higher. This is in some cases required by the specific model that is being implemented, but in other cases is not. So this was a fairly high rate of bachelor's degree. Supervisors have a much higher rate, close to 90%, or on average. And that, again, is probably not surprising, is that is a minimum requirement often for becoming a supervisor. Many had prior work experience in home visiting, as we talked about earlier, and most feel pretty confident in their skills, rating their professional expertise as either proficient or expert. Interestingly, and this will be relevant when we get a little bit later in the presentation, but more than 20% of supervisors had never worked as a home visitor before. Perhaps they had other supervisory experience, but they may not specifically understand the experiences of home visitors who are in the field working with families every day. A third key finding is that approximately 1/3 of program managers report currently having one or more vacancies, and that recruiting bilingual job candidates in particular is a top challenge. This figure here shows what program managers reported as being particularly difficult to recruit for. As you can see, more than 40% of program managers report that finding a home visitor with bilingual language skills is extremely difficult, and another 22% also consider it very difficult. Finding individuals with relevant expertise and experience was also top ranked, though that was much less of a concern, and that's reflected in as well, or reinforced by the earlier findings that many home visitors actually have quite a bit of experience prior to their existing or their current job. Something we heard over and over again while we were in the field was the importance of finding individuals who are really a good fit for home visiting. This program manager summed it up this way: skills are one thing, but fit is huge. When we've hired for skills alone, we've regretted it. They have to have the heart and be from the place of wanting the best for their clients. A fourth key finding relates to home visitors' experience both with in-service training and then other ongoing trainings that they may receive during their tenure as a home visitor. Specifically, we heard that home visitors are interested in more in-depth training that might better help them to better serve their family, the needs of families that they work with. So there are multiple kinds of training. Onboarding, specifically when a home visitor is newly hired to a position, has two primary components, including organizational onboarding, like those trainings that might be led by a human resources department, that might be more about specific agency requirements, and then new staff training that is led by model developers and is really focused on the home visiting model that is being implemented specifically. The new staff training can often be multi-day, often requires travel, and the timing of that model developer training can be a little bit tricky, as sometimes there's a long gap between hire and training, or sometimes there's no gap whatsoever, and somebody isn't even really has barely met their new colleagues before they're off and being trained somewhere else. There are multiple perspectives that we heard on what the ideal timing is for model training. Some folks felt that it's really important to do this as early as possible to be able to get home visitors into the field and really understand what it is that they'll be doing. But others felt that there's real benefit to waiting a little while and giving home visitors some experience in the field, or at least the opportunity to shadow folks before going out and receiving model training, because it helps them to know what questions they have about implementing the model before receiving so much information. Shadowing is a really important component of training for home visitors, and nearly everyone indicated how critical it is to both job success and job satisfaction. Nearly all program managers report requiring job shadowing, but the timing of that shadowing can vary considerably. Some require shadowing before hiring a home visitor. This is both an opportunity for the potential candidate to really understand what they'll be experiencing in the job, but also an opportunity to observe how a potential candidate might handle themselves in the field. Additionally, it could more commonly, it really happens after being hired. There are privacy concerns, both for the pre-hire, which is what's stated here, but sometimes also for shadowing that happens afterwards. Some home visitors feel very protective of their clients and don't necessarily want to expose them to new people. Also feel that it's a burden to ask them to participate in a shadow visit. So that said, almost everyone indicated that shadowing is an extremely valuable experience, as demonstrated by this home visitor's quote. "The best training at all was just to go shadow a home visit and see what it was all about." So in-service trainings, which are trainings that might happen on an ongoing basis for home visitors, are quite varied. And there was variation in the degree to which home visitors felt that they were particularly useful as well. So there are a variety of sources for these trainings. They could come from model developers or a McVie state agency, a university, or a national organization. Some of these required significant output of funds, and that can be challenging in both a grant environment and also just, where there are limited funds available. There again could be travel restrictions, and especially for those who are in more remote areas. And there are in-person and virtual platforms that are available for trainings, and I think that there's a lot of variation in terms of who prefers what, and what feels more engaging. I know that the Ounce of Prevention is doing some research in this area, and that will be really interesting to follow as time goes on, to see whether how to maximize the opportunity for folks to be able to access trainings, perhaps by doing, really engaging virtual trainings. The other thing that came up often is just the tension between being trained in important skills and concepts while also attending to the needs of families that home visitors are committed to. Here, a home visitor talks about that delicate balance between those opportunities and the actual home visits. A fifth key finding that came out of this study is that home visitors are highly motivated to work with families. They're also attracted to home visiting jobs because of the flexible work schedule and the employee benefits that some of them receive. So here you can see from this figure that helping families and gaining a feeling of purpose are really high on the list of why home visitors and home visiting supervisors have chosen this career. Many also appreciate the flexible work schedule that is often available in these types of jobs. These are just a few quotes from folks about what they find rewarding in the work that they do, the joy of watching them grow up and everything. That is the joy that's kept me here for 23 years and keeps me going, said one home visitor. And a program manager observed that some may earn more working at other places, so I don't think salary is a draw, but the benefits are really good, and many places don't offer that anymore. This might be particularly the case when home visiting programs are located in county or state public health departments or other government affiliated agencies, but is also true for some larger nonprofits as well. So a sixth key finding is that home visitors are quite satisfied with many aspects of their jobs, but they're typically dissatisfied with their earnings and opportunities for promotions. We spoke about earlier how there are it's a relatively narrow pipeline for home visitors, so there aren't a ton of opportunities for advancement within the field. Here you can see, this is a report from program managers on what they perceive to be the reasons that the recent that they've lost home visitors over the years. One of the primary or the top reason that they perceive is that they've left because of the low salary or because they desired a different kind of work. Here we hear from both program managers and home visitors about the challenges associated with low pay. I think they stay because their commitment to the work, and they leave because they feel undervalued and underpaid, one program manager observes. And another home visitor talks about how it's really been a hardship for her. Myself, along with another coworker, we've already expressed that we might not be able to stay here. I'm living paycheck to paycheck. And then there are some tensions when it comes to retaining staff in the long run. You know, one program manager really wants to encourage her home visitors to go back to school, but she also recognizes if you go back to school, you probably won't stay here. For the most part, home visiting staff reported that their caseloads are just about right. The average caseload reported was 16 families per home visitor, and 67% of home visitors claimed that their caseloads felt about right. A few felt that they were heavier than they could handle, and some felt that they were lighter than they could handle. Importantly, none of this is benchmarked to what is actually required of the model. Sometimes home visiting models or state agencies might have specific requirements on how many caseloads, how many cases a specific home visitor should have, and we don't know if this average number of 16 families is above or below that, but what they currently do have seems mostly about right. Supportive work environments came up a lot, and the role that they play in promoting job satisfaction and retention. When you don't feel valued, one home visitor says, you won't be highly motivated. And when someone tells me great job with that client, that makes me glow, makes me think someone is grateful and I'm doing something right. One component of supportive environments may rest on the interactions that home visitors have with their supervisors. We observed that about 66% have an interaction, a one-on-one meeting in particular, with their home visiting supervisor at least once a week. Another 15% meet once every 2 to 3 weeks, and yet another 15% will only meet with their home visitor monthly. Reflective supervision, which is a core component of home visiting and is designed to really help home visitors manage their stress and reduce burnout over time, was cited over and over as really an important piece of the puzzle. Here, a home visitor talks about reflective supervision as a special sacred place where you don't feel judged. There were mixed thoughts about the benefits of reflective supervision in some cases, especially where they didn't feel that their supervisor was particularly skilled at reflective supervision, or couldn't really understand the experiences of home visitors, perhaps because they didn't have home visiting experience themselves. And the last key finding I'm going to talk about today is key finding 7, the experience of a promotion, perceived work environment quality, and schedule flexibility, as well as work-life balance, are associated with a greater intent to stay. So we had an opportunity to do some adjusted analyses to predict job satisfaction and intent to stay based on our survey data. And we observed that the following 4 factors are positively related to both job satisfaction and intent to stay. These included experiencing a promotion, perceived quality of work environment, work-life balance, and home visitors' age. We also observed that having the opportunity to telework and regular team meetings for group reflective supervision were associated with greater job satisfaction. And having a bachelor's degree and being in school full-time was associated with a lower likelihood of staying in the home visiting position. Job earnings and employee benefits, despite some of the qualitative and other findings that we've presented so far, were not significantly associated with either outcome after controlling for some of the other factors. So now I'll go into a little bit more detail about those implications that I presented briefly earlier. So based on our findings, we observed that investing upfront in strategic recruitment efforts to find qualified staff that are a good fit for the position is really important, as I'd mentioned. And some suggestions folks had regarding how to do this relied on the importance of crafting clear job descriptions, and that these job descriptions should be specifically linked to the competencies that the program was looking for. We heard over and over again how important it is to involve program staff in both application screening and interviewing. In some larger agencies, there was often HR staff assigned to screen up applications, and that sometimes was perceived to be really challenging because they didn't necessarily look for the things that the home visiting program really thought was, they didn't have the same priorities as the home visiting program did when it came to specific qualifications. Integrating scenario-based questions in the interview, what came up over and over again, is really critical for finding somebody who they thought would be a good fit for the job. And in some cases, requiring qualified candidates to observe a home visit was cited as being really very useful, though we did talk about some of the challenges associated with that as well. Some suggestions for where to find individuals who might be a good fit for this included advertising home visiting positions at local colleges and universities, as well as partnering with local institutions of higher education to create internship or job shadowing programs to allow folks to be exposed to the job of home visiting. Creating a system that supports professional development, goal setting, and continuous learning was another finding or another implication that emerged from our findings. There was a suggestion that this be done formally, perhaps on an annual basis, to help identify learning goals and develop a plan for meeting those goals. It was recommended that this information be shared with McPhee agencies and home visiting models to help inform staff training needs. There were suggestions that offering tuition reimbursement could be really valuable, and some programs do this, but not across the board. And a formal peer mentorship program could be really beneficial in supporting professional development on an ongoing basis. Making home visitors feel valued is something that certainly came through consistently in our findings, and some suggestions for how to do this included through reflective supervision. As I mentioned earlier, implementing regular team meetings to discuss cases in a group setting was cited as beneficial, and scheduled reflective supervision meetings. Providing dedicated staff to support data entry and other time-consuming tasks was something that emerged frequently. Data entry demands can be quite onerous for home visitors. Some did indicate that they actually liked the data entry, but for the most part, we heard that this was really a distraction and took them away from what they viewed as really the core component and the core activity of their job and the mission that they were drawn to, which was to interact with and support families in their homes. Ensuring that home visiting programs interact with other programs in agencies that have multiple programs came up frequently. And this was something that was recommended to prevent isolation, and creating a workplace culture that really celebrates staff accomplishments, which is a challenge in a setting where there are few, if any, opportunities for advancement. Which leads me to the last implication on creating opportunities for leadership and advancement. As I mentioned, typically in a home visiting program, there are few opportunities. Generally, there are home visitors, and then perhaps one home visiting supervisor, and then maybe, if this is not the same person, which it sometimes is, a program manager. That might be it. If you have 10 or 12 home visitors and one home visiting supervisor position, there's not going to be a lot of opportunity for those 10 to 12 home visitors to grow in their career necessarily, except when it comes to experience. So perhaps recognizing years of experience, giving those more experienced home visitors an opportunity to do peer training and coaching of new staff, delegating some supervisory responsibilities to home visiting, to experienced home visitors as well, was a recommendation, or as an opportunity to really acknowledge the skills that they have. And then this slide really just is an opportunity to think about what we might recommend future research focus on. I think there are opportunities for more descriptive studies that compare both the McV and non-McV funded programs. This study, as we mentioned in the beginning, was focused only on McV funded agencies and the workforce that is hired within those contexts. There are also many non-McV funded programs throughout the country. They may or may not be systematically different, and I think a comparison of those could be really valuable. It would also be useful to estimate turnover rates and patterns with administrative data and or exit interviews. The data we have on why individuals leave the job is somewhat limited by the fact that this is a perception of the program manager, and is, we were not able to collect information on why folks had left in the past. So that would be something that I think could be really beneficial to the field, and really inform our understanding of why folks do leave the jobs. Design and development studies that might be useful to do include identifying examples of career pathways and using those as models for other programs, researching loan forgiveness programs and tuition reimbursement opportunities for employee benefit packages, and then an effectiveness study on evaluating strategies for reducing staff burnout and improving retention could be really valuable to the field. So that is all for my presentation today, and we can go through some of the questions. We have a question on what findings were particularly surprising. It's a great question. I think that probably different folks on the research team have different answers to this, but something that I was really struck by was the importance of the work environment. So not necessarily, we hear a lot, or over the years I've heard a lot about the risks associated with burnout because home visitors are asked to work in really challenging situations and are often at great risk of compassion fatigue or secondary trauma. And there's a lot of concern about that, and that's a really valid concern. But what I heard from folks in the field was that it's perhaps equally or similarly important to really think about the ways in which a work environment functions to support home visitors. So, if it's a really collegial staff environment, or the relationships between leadership and home visiting staff are really mutually supportive, that can be so beneficial in protecting folks in the long run. I was also somewhat surprised to learn that many home visitors don't necessarily, while they want to be acknowledged for their expertise and the time that they've spent, they don't necessarily want to become a home visiting supervisor. They really value the time that they get to spend with families. And so that pathway for advancement may not, really doesn't work for everybody. I'll wait a few minutes to see if any other questions come up in the question and answer box. But in the meantime, I am also interested to hear from the audience if there are specific things that you think resonate or don't resonate with your experiences or your knowledge of the home visiting field based on the findings that we've presented today. Okay. I'd also really like to encourage folks to visit our landing page. We have both the full report available on urban.org. We have a Home Visiting Career Trajectories landing page there, and we will have more. We will have more products coming out shortly as well. Yeah, so this next question is about the rate of home visiting burnout and how only about 4% of visitors cited burnout as a reason for leaving. But this is a reason that we hear that folks do leave often. So again, there are some limitations to these data. One of the limitations being that the reason that people leave slide is based on a survey of the program managers, and so their perceptions could be somewhat off. This is why they perceived that folks left the job, not necessarily why people report that they do leave the job, or even if they perhaps reported it to their program manager when they left. We know that folks aren't always honest about that. That said, I suspect it's kind of an interaction between, being asked to do so much in really hard circumstances, but also being compensated so little. And perhaps what rises to the forefront is the low salary piece, but it's very possible that burnout is actually a component of that. But this is a reason that I think future research on that asks folks specifically when they are leaving a job what it is that motivated their departure would be really valuable. Okay, so this next question is about reflective supervision. And was data collected on the education, training, and experience of the reflective supervisor. And so reflective supervision, so some, if not most, supervisors do receive some reflective supervision training. We did hear from some supervisors that they wish that they had more. They didn't necessarily feel like they were particularly skilled in providing the reflective supervision that they were being asked to do. And that might also influence whether or not and how often they did provide it. We did not look at the consistency of what is being provided, and we were not able to necessarily tie satisfaction with reflective supervision to how skilled the supervisor was. But that would be an important follow-on study, I think. So there's a question here about advocating for better pay for home visitors. BAs are, and the role that having a BA has in becoming a home visitor. I just want to make sure that I clarify that there are many home visiting models that do not require a BA to become a home visitor. So that is not the requirement across the board, but we did find that most home visitors did have a bachelor's degree, regardless of whether or not it was a requirement. Questions on how to advocate for better pay for home visitors. That's a really tough one. I know that there are some movements afoot to try to get Medicaid reimbursement. I mean, I think that ultimately the efficacy studies that exist when it comes to demonstrating the value of early childhood home visiting are really compelling on that front. And then there's a question about whether or not whether or not we feel that home visitors are able to identify what burnout is or the symptoms related to burnout. I believe this is often part of home visitor training. And I know that over the years, there's been quite a bit of focus on burnout. I can't really speak to whether or not home visitors are able to identify that or not, but that is an interesting question that I think there's probably a better resource for that than me. Okay, I don't see any other questions. Give it just a few more seconds, and then if we don't have any other questions, then I think we can, oh, here we go. Hi, Janelle. Yeah, so there are a few other opportunities to get additional information on this study, in addition to this webinar being posted on our landing page, as well as some other webinars that we've done. There is going to be a webinar focused on professional development specifically, that is hosted by the OUNT Community of Practice for Professional Development. This will be on April 8th at 2 p.m. And I would recommend you go to the ounce.org in order to get more information on that. Okay. Well, thank you, everyone. This has been a real pleasure, and I hope that if you have additional questions, you'll feel free to reach out either by email or telephone. And I hope this was helpful, and please do look for our findings in written form on the urban.org website.